Well, thank you everybody for being here, and welcome to Alpine Learning Group's Innovations in Autism series. This webinar, Preparing Your Child for Medical and Dental Visits, is one in a series of free webinars presented throughout the month of April. At the close of the presentation, we'll share a QR code to learn about our other presentations in this series. For those of you who may not know, I'm Dr. Bridget Taylor, co-founder and CEO of Alpine Learning Group. And for over 30 years, I've had the pleasure of working alongside an innovative and compassionate group of leaders in the field of autism here at Alpine Learning Group. And I'm happy we're able to share their expertise with you here today. A few housekeeping issues before we get started. This presentation is being recorded and will be made available on our website in the coming days. So if you know anybody who couldn't be here today, please feel free to share that information. We'll also send an email out to all registered participants once the recording is available. If you have any questions, I encourage you to use the Q&A or chat feature. I'll be monitoring that throughout the presentation. Feel free to type questions that come up for you throughout the presentation, and we will have a few minutes at the close of the presentation today to answer your questions. And now I'm very excited to introduce two of Alpine's BCBAs, clinicians par excellence, Cortney DeBiase and Sarah Losowyj, and they will be presenting today on preparing your child for medical and dental visits. Take it away.
All right, good afternoon, everyone. As Bridget mentioned, we are here today to share with you how to prepare your child for medical and dental visits. And this is just one of the presentations in our webinar series. Okay, today's agenda is going to include discussing the importance of medical care, challenges associated with medical care, strategies to help your child participate in various medical appointments, and some important key takeaways to make these appointments successful for you and your family. Okay. So children and adults with autism are at a greater risk of comorbid issues such as seizures, gastrointestinal disorders, sleep disturbances, eating and feeding challenges, and mental health issues. So it's really important for them to be able to participate in medical appointments so they can receive the care that they need to live happy and healthy lives. Another reason we're focusing on this topic is because it's common for individuals with autism to display fearful behaviors when participating in medical appointments. So some of the common fearful behaviors you may observe might be escape behaviors, such as crying, self-injury, elopement, or running from the procedural area. In fact, Gillis et al. Found that 31% of children with autism have fears related to medical appointments. This is 3 times the prevalence of those children without autism. So what might happen if we don't teach our children with autism to participate in medical appointments? They may have illnesses that go undiagnosed that can lead to even more medical problems. There may be delays in receiving appropriate treatments. They may require overuse of sedation for procedures that necessarily would not require sedation. They may also require some sort of physical restraints or mechanical restraints. So if we could teach children to participate in medical exams and procedures, we might be able to eliminate the use of these aversive procedures, and it'll make for a more pleasant experience for everyone involved. Okay, so we're going to start with an overview of the teaching procedures that will help your child overcome the fear of medical appointments. So the first thing you're going to want to do is meet with the medical professional performing the procedure or checkup and discuss the procedure in detail. We do recommend that you meet with a medical professional without your child present. Discussing the procedure in front of your child can increase their nervousness about the procedure and even cause some anxiety in the moment. So once you've discussed the procedure with the medical professional and identified all of the steps of the appointment, you can make a task analysis. So you might be wondering, what is a task analysis? A task analysis is just a list of the steps involved to get you to the end result. So think about this. Have you ever made a peanut butter and jelly sandwich, right? The end result is that sandwich, but in order to get to it, you need to get the bread, you need to get the jelly, you need to get the peanut butter, the knife. It's all of these little steps that get you to the end result. So that's what we're going to do here. We're going to break down that appointment into many little steps. I apologize. Okay, so after you've met with a medical professional and developed your task analysis, you're going to want to get the materials needed to practice the procedure at home. You can often find a lot of these materials online or at your local drugstore. But think about it. You can even ask your medical professional, your team that's performing the procedure, if you can borrow some of their materials. Most often, they're going to volunteer and voluntarily let you use those. We'll now discuss some of the teaching procedures that you can use. The first one's going to be modeling. You can model the steps of the procedure for your child. If you're practicing the steps of listening to their heart, you can use a stethoscope and listen to your own heart, or you can listen to the heart of another person, or even one of their favorite dolls or toys. Seeing other people complete the steps can really help alleviate some of the fears and anxieties associated with the procedure. Show your child that this really isn't scary and that you're practicing it too. The next thing you could do is role play the procedure at home. You and other family members can play the role of nurse, doctor, or dentist and teach the steps of the procedure you've included in that task analysis. Another strategy we like to use is shaping. Shaping is a process of breaking down and providing praise for successfully completing a small step within the task analysis. For example, if you're teaching your child to participate in dental cleaning, but they're uneasy about flossing, you may initially start by modeling flossing on yourself or another person or the doll. Then you may have your child hold the floss. Then you may touch the floss to your child's mouth. And finally, you'll be able to floss their teeth. You may initially only floss for a few seconds and gradually increase the amount of time spent flossing over the course of the role play sessions. The goal of shaping is to teach your child to participate in successive approximations to get to the final result. So think of it like baby steps. Another teaching strategy we use is counting. So you can count during some of the steps of the procedure. So for example, while practicing flossing during a dental cleaning, count to 10 while you floss. Once you reach 10, stop and move on to the next step. Counting can help your child know when to expect a certain step to end. This creates predictability during the procedure, which can lead to less apprehension for your child. You can also use a timer or a stopwatch as a visual cue. That would also be helpful. We'll show you a video of counting later on in the presentation. Most importantly, praise your child for their successes during medical procedures as well as during your role play and practice sessions. Let them know they're doing a good job. Let them know they're doing a good job sitting still, keeping their mouth open, keeping their hands down, staying in the instructional area, following directions, right? You may also want to identify a reward that your child can earn for successfully participating in the procedure. Maybe something that they don't have access to often, right? We're going to make sure it's really motivating. Maybe they can buy a new toy when they're done and have that special snack. Okay, so just really make sure we're providing praise. It's extremely important. Okay. So like I mentioned earlier, you want to meet with the medical professionals without your child before the procedure to discuss what the procedure is going to entail and what materials might be used. You're going to role play the procedure at home and have different people play the role of the medical practitioner. Teaching your child to be successful with a variety of people during the role play will help increase the likelihood that they'll be successful with different medical practitioners at the office or the hospital. Do your role play session several days or weeks before the procedure. If the procedure is new or one that your child particularly struggles with, practice months in advance. Set a reminder in your phone or calendar a few weeks before the appointment. This way you can remember to start practicing. Another important tip is to do your research to find a medical practitioner that is a good fit for you and your child. Ask parents or other children with autism if they have any recommendations. Reach out to your child's school or day program and ask if they have a list of practitioners that other children have used and have had success with. It's also really important to try and schedule your visit for the first appointment slot of the day. The office will be quieter and medical professionals should still be running on time. This will avoid you guys having to wait in a waiting room, and it'll avoid just a lot of waiting room concerns. Lastly, fill out any required paperwork ahead of time. This will reduce the time spent in the waiting room and also free you up to be able to focus your attention on helping your child during the procedure. Okay, so we're going to show you some videos. And this is an example of a child practicing to receive a rapid COVID test. He's working on the first step, which is just tolerating the cotton swab being held several inches in front of his face. You'll hear the person role-playing as a nurse counting during this video.
1, 2, 3, 4, 5.
Okay, so as you can see, she is, thank you, Sarah. She is wearing the nurse's jacket. She has her gloves on. So she's really simulating and making it look realistic. Okay. This is the same child practicing the next step in the procedure, which is tolerating the nasal swab, touching his nose.
1, 2, 3, 4, 5.
Okay. So you heard the counting. He knows when they're going to stop counting. It's predictable. Okay. And this is the same child practicing with the final step during the role play session. He's tolerating the cotton swab being inserted into the nostril.
1, 2, 3, 4, 5.
Okay. As you saw in all three of those videos, the person playing the role of the nurse was wearing disposable gloves and sometimes even a lab coat and face mask, like I said, to make it look realistic. A different person played the role of nurse each time. And this is to teach the child to cooperate with receiving the COVID test from a variety of different people. They're not always going to see the same nurse. They're not always going to see the same doctor. So it's important to teach them to generalize these skills to a variety of people. The child did successfully receive a rapid COVID test from a medical professional shortly after this third video.
So now we're going to talk about preparing your child for medical and dental visits that occur more frequently. First, we'll discuss yearly physicals with your child's primary care physician. We'll go over how to create a task analysis, get your materials together, and what your role play sessions might look like. Here's an example of a task analysis that you might make for your child's doctor's appointment. And as a reminder, a task analysis is the breakdown of the task or process into a set of smaller steps. So here we have step 1 is entering the exam room while someone is wearing a lab coat, then greeting the doctor or nurse, answering the question, how are you? Getting their temperature taken, their blood pressure taken, blood oxygen level taken, and then standing still on a scale to get their weight, and then standing up straight and still to get their height measured, letting the doctor check their ears with an otoscope, letting the doctor check their throat with a tongue depressor and a flashlight, then a reflex check with a reflex hammer on their knee, and then laying down on the table while the doctor palpates their abdomen. You should individualize this for your child. For example, if your child is 6, they might have a scoliosis check done at their physical exam, but if your child is 26, they probably won't have a scoliosis check done. Also, your child's physician might use a blood pressure cuff that needs to be pumped manually, or they could have an electronic blood pressure cuff. Your child also may participate in an ear and eye exam if they go to a pediatrician. That's why it's important to meet with your doctor ahead of time to discuss all the steps of your child's exam. Here are some of the materials that you might need to role play your physical exam. You can get a lab coat, disposable gloves, stethoscope, thermometer, blood pressure cuff, pulse oximeter, or that little machine that goes on your finger to measure your pulse and your blood oxygen level, the otoscope, which is used to look inside your ear, tongue depressor, flashlight, and a scale. It's okay if you don't have every single item that's necessary to perform a doctor's appointment. Just focus on the things that your child struggles with the most. If there's some materials that you can't find, just simulate as best you can. For example, if you can't find or don't want to buy an otoscope, you can use an in-ear thermometer to simulate that same sensation during your practice sessions. Once you have all those materials and your task analysis, you can begin your role play to get your child ready for your appointment. And if you're not ready how to role play some of the parts of the exam, look to the internet. YouTube has a lot of great videos demonstrating how to take blood pressure, check reflexes using a hammer, and other aspects of your child's doctor's appointment. Here's a video of a child practicing for a physical exam at school with the school nurse. And just to give you some background, he used to scream every time he went near the nurse's office. So he started practicing for his yearly physical exam in the classroom with his teachers. Once he was able to do that successfully, then he started to practice in the nurse's office also with his teachers, and then slowly introduced the school nurse. So here's a brief clip of the school nurse checking his throat. All right, the video can't be loaded, but he's opening his mouth, following the nurse's instructions, and keeping his hands down and sitting on the table. And she's also praising him for keeping his mouth open during the steps. Now we can talk about biannual dental cleanings. So again, here's an example of a task analysis that you might make for your dental cleaning. So entering the room while all the dental tools and the hygienist are present, greeting the dentist or hygienist, sitting in the dental chair, letting the hygienist put the bib on, follow the direction to open your mouth, letting the hygienist touch each tooth with a scraper and then scrape off the plaque of each tooth, brushing the teeth with the polisher, rinsing out mouth, flossing the teeth, and keeping the mouth open while the hygienist applies fluoride treatment if your child goes to a pediatric dentist, and then letting the dentist come in to examine the teeth. Once a year, your child will also need x-rays, which might be something you need to add to your task analysis. And again, individualize it for your child. If you have an 8-year-old, they'll probably get fluoride treatments. Your 28-year-old will likely not get fluoride treatments at their dental cleaning. And speaking of fluoride treatments, there are 2 different ways that can be done. So you can find out if your dentist uses the dental tray that your child has to bite on, or if they paint on the fluoride treatment with a small brush. Some of the materials you might need are a lab coat, disposable gloves, a dental bib, dental mirror, tooth scraper, electric toothbrush and toothpaste, floss, a fluoride tray or a small brush, and a cup with water. And again, a lot of these things you can find on Amazon, CVS, Walgreens, and improvise where you can. If you can't find any dental bibs, you could use a paper towel or a paper napkin. And once you have your task analysis and your materials, you can begin to role play. And of course, YouTube has a lot of great videos. They have some great dental assistant training videos on there so that you can really mimic what a dental hygienist would do during your child's cleaning in your role play sessions. So this video is a student who learned how to cooperate with a dental procedure at school with her teachers. Then she had students from Bergen Community College that are dental students come in and practice for a dentist visit with her. And now this video is of her at Bergen Community College in a room to set up to look like a dentist's office, and she's practicing for a cleaning with one of those Bergen Community College dental students.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Beautiful.
Good girl.
So you can see the dental assistant was counting during the steps and providing praise for sitting nicely. Now we can talk about preparing for a blood draw at your child's doctor's office, or even a lab like LabCorp or Quest Diagnostics. Here is a sample of a task analysis you might make to get your child ready for a blood draw. So them entering the room with someone wearing a lab coat being present, greeting the phlebotomist or nurse, sitting in the chair, extending their arm on a desk or table, or placing their arm on the padded armrest of the chair, answering the question, how are you doing? Letting the phlebotomist tap on the veins in their arm or their hand, letting the phlebotomist apply a tourniquet, and then either making and holding a fist or squeezing a stress ball, and then letting the phlebotomist insert the needle, sitting still while the blood draw takes place, removing the needle, and then letting the phlebotomist apply a Band-Aid. And again, you want to tailor this to the steps of the blood draw that your child will be experiencing. Some people draw blood from the arm and some people draw blood from the hand. So find that out ahead of time so that you know where to target your practice for your child. Here are some examples of materials that you might want to get. So again, a lab coat, disposable gloves, a needle that's trimmed or bent with wire cutters to get blunt ends, or you can remove the needle completely. Some vials, alcohol swabs, or just cotton balls that you can dip in rubbing alcohol, a tourniquet, medical tape or adhesive bandages, and a stress ball. Something else you can also do while you're practicing, if your child is afraid of needles or looking at the needles or the blood draw makes them a little upset or anxious, it makes me anxious, you can wear a baseball cap and angle the brim of the cap down at an angle so that it blocks their view of the needle or the blood draw. And if your child doesn't like to wear hats, you can always have them focus on a spot on the wall or at the ceiling or look at you. So once you have those materials, you'll be ready to role play. And remember that these are just role-playing sessions and only simulations, so you don't actually have to break the skin to really adequately prepare your child for the blood draw appointment. Merely having the needle, whether it's bent, cut to be blunt or removed near the area, should be fine. So here's an example of a role-play session with a man practicing with 2 of his instructors for his day program. It might be hard to tell from the video, but the instructors remove the needle so that there is no needle near the man while he's practicing, just for safety. But he was able to successfully go to his doctor's office with one of his instructors and get his blood drawn. Now we can talk about some less frequent procedures like receiving anesthesia, vaccines, or taking liquid medicine. First, we'll talk about anesthesia. So like Courtney discussed earlier, some people with autism have such a difficult time participating in medical and dental procedures that they might need to be sedated in order for the procedure to take place. And here's an example of a task analysis that you might make to prepare your child to undergo anesthesia. They might hear the anesthesiologist saying, you're going to take a nap or you're going to go to sleep. Then they'll wear an oxygen mask and then take deep breaths while wearing that oxygen mask. Some of the materials you might need would be an oxygen mask, a hairnet for your child to wear, the pulse oximeter, which takes your pulse and your blood oxygen level, an IV, and if you've been practicing for blood draws, you can just use those same materials to practice the IV, and a gown for your child if you think that's something that they might struggle with. And again, you'll want to check with your medical practitioner to see whether an IV will be necessary and if it will be placed in the hand or the vein, or the arm vein, because if you don't need to practice it, don't stress yourself out by trying to get all these materials together. So once you have your task analysis set up and your materials, you can begin role playing. So we don't have a video of someone undergoing anesthesia, but this boy had to undergo anesthesia for a dental procedure. His mom actually asked the dentist if there was anything that she could borrow to get him ready for the procedure. So the dentist sent home some of the oxygen masks that they use to administer the anesthesia. The dentist also explained all the steps to mom so that she could make a little task analysis for herself and practice at home. And then she sent the task analysis and the oxygen mask into school so that his teachers could practice with him as well. And I know he has a mask on, but even with the mask on, you could tell he's really smiling and really prepared for his procedure. Next up, we'll talk about vaccines. So here is a sample task analysis that you might create for your child. So they'll hear it's time for your shot. Also, if you know that some of this might be upsetting for your child, just hearing about the shot, you can always let your doctor know ahead of time. Don't mention it, just get started right away. So that's what we mean when we say really individualize it. If there's some things that are really stressful for your kid, we can just cut them right out of the procedure if possible. They'll need to get the injection site cleaned with rubbing alcohol, let the nurse gently pinch the injection site, sit still while the vaccine is being given, and then let the nurse put a Band-Aid on the injection site when they're done. And same thing, if seeing the needles is a little nerve-wracking for your child, you can do the same baseball hat trick as we discussed during the blood draw. So they can put a baseball cap on, angle the brim down and to the side so that it blocks their view of the vaccine. Here are some of the materials you might need for your role play. You can get a syringe and you can either remove the needle completely or bend it or cut it to make a blunt end, alcohol swabs or cotton balls with rubbing alcohol, and then some adhesive bandages. Once you have that, you'll be ready to role play. And just like we talked about during the blood draw as well, you don't need to break the skin to practice the vaccine fully, just gently pressing the needle or the syringe up to the arm is fine. So this is a video of a boy practicing to receive his vaccine with his school nurse. He really liked to watch the nurse giving the vaccine. and it didn't really seem to cause him any stress, so we just let him watch the vaccine.
Here you go, buddy.
You ready?
Are you ready?
1, 2, 3. Look at that. You're such a good boy. Done.
Amazing.
Okay. Stuck to my glove.
So just like the other videos that we've shown you so far, the nurse was counting, she was praising him for doing such a good job, and these are all things that you can do during your practice sessions as well. And lastly, we'll talk about taking liquid medication. So you might set up a task analysis like this, hearing that it's time for your medicine. Your child will open their mouth, let you put the medicine in their mouth and swallow the medicine. Maybe if they're more independent, they can take the medicine from you out of a cup and they can swallow it themselves. And here's some of the materials you might need. So if you have a younger child or a child who really has some difficulty taking liquid medicine, you might want to use a syringe. You can also use a medicine cup or a spoon. And then to simulate your medicine, because you don't want to be practicing with actual medicine, you can get some water, some juice, some food coloring to dye your water to make it look like medicine, and some thickening agents that come in a powder form that you can mix with the water or juice to thicken it up a little bit so it becomes the consistency of a liquid medicine. So once you have all those materials and you have your task analysis ready, you can begin your role play sessions. And Courtney mentioned shaping earlier, which is the process of breaking down and providing praise for successfully completing smaller steps, leading to the end goal, which is one of the complete steps in your task analysis. And we're going to take a look at an example of how you might use a shaping procedure during your role play sessions. So maybe your child is really against taking liquid medicine. You might first teach them to swallow water from a medicine cup if they like water, or you could put their favorite juice in the cup. So once they learn how to do that, then you can have them swallow water mixed with juice or food coloring so it looks more like the medicine. Once they're able to successfully swallow the juice or the dyed water, then you can mix in the powdered thickening agent to get the consistency to be more similar to medicine. And then you can practice with that a few times leading up to them needing to take actual medicine. Now we'll discuss how to prepare your child for some visits that may be difficult to practice. Practice for as much as you can. Ask a lot of questions about the details of the procedure to what you can simulate at home. And then, like with the anesthesia example, you can have your child practice wearing the oxygen mask and taking deep breaths, but you won't be able to practice them falling asleep or waking up from the anesthesia. It's okay if you can't practice every single aspect of the procedure. Any practice at all is better than no practice. You can ask some questions about the sights, smells, sounds, tastes, and textures that your child will experience. For example, if you need to get your child an EEG, the adhesive that they use to attach the electrodes to your scalp have a really strong nail polish remover smell, which not a lot of people like. So you can get your child used to that smell leading up to their appointment. So you can have your child sitting down and then maybe you're across the room with an open bottle of nail polish remover. When they're able to sit appropriately during that, maybe you want to come a little closer with the nail polish remover, hold it maybe a foot away from them. Once they're tolerating the smell closer to them, you can then put it on a cotton swab and then hold the cotton swab near their scalp, which is going to be really similar to what they'll encounter during the actual EEG process. So again, practice for as much as you possibly can. Then you can find out if your child has to stay in any certain position for a long period of time. Maybe they're getting an X-ray or they're getting an ultrasound and they have to lay on their back or put their arm in a certain position. You can practice that at home also with your child so that they're ready to stay in that position for the certain amount of time that they have to during the procedure. And then lastly, you can ask if there's any unfamiliar instructions your child might have to follow. So during an eye exam, an ophthalmologist might ask your child, hey, can you follow my finger with your eyes? Or back to the ultrasound example, maybe the ultrasound tech will tell your child to lay on their left side with their right arm above their head. Those are directions they're used to following. So you can practice them following those directions at home to increase their likelihood that they'll be really successful and follow that direction at the day of the procedure. So just to wrap up, there are some important takeaways from what we discussed. We want you to research your medical practitioners in your area to see who works with special needs children. You can ask other parents who have kids on the spectrum who their children see. You can also ask your child's school or day program if they have any medical practitioners that they recommend. Meet with your child's practitioner ahead of time without your child present. You can ask them to walk you through the procedure, including what materials are used, if you can borrow any of those materials so that you can role play and practice at home, what sights, smells, sounds, etc. that you might encounter during the procedure so that you can simulate those. Then if your child will have to follow any specific instructions or sit or lay in a certain position for an extended period of time. Then you'll want to create your task analysis of the procedure and gather all of your materials together. Remember, if you can't find all the materials, that's okay. You can simulate as best you can with what you have at home. And role play using modeling and shaping at home frequently, several days or weeks before the procedure. Have different people play the role of the medical practitioner if possible. You know, get your spouse, your other kids, other family members involved. Watch videos on YouTube to improve your role play skills. And I would also recommend recording your sessions that you do, your role play sessions at home, and then showing your child's medical practitioner. That way they can see what you did and mimic some of those steps, such as the counting during some aspects of the procedures. And this will help keep things really consistent for your child and really predictable, and hopefully reduce anxiety and result in a really successful appointment. You also want to share tips with your medical practitioner that they can use during their appointment to help your child be successful. If you notice that when you give the instruction, open your mouth before you check their throat with a tongue depressor, makes your child really upset, let your doctor know and maybe they can say something else. Remember, the medical practitioner is an expert in their field, but you are the expert in your child. And the procedures that Courtney and I discussed with you today can be used to help your child participate in a wide variety of medical procedures and visits that we didn't get a chance to cover today, like eye doctor exams, getting an X-ray, and more. All right, thank you very much. Anybody have any questions?
Thank you, Courtney and Sarah. That was terrific. I'm going to look at the chat here and see if we have any questions. Any questions in the Q&A? We're happy to stick around with some questions. Okay, it doesn't look like there's any questions.
All right.
So we are doing this webinar series. Sarah, the next slide, I believe, has the Q&R code. Okay, so here's the QR code to the rest of our presentations. Please spread the word and join us throughout, the rest of April for the rest of these series.
Yeah, so this webinar is only one in a series that we are conducting. We've had, I think, 2 already. So feel free to scan the QR code and learn more about our webinar, our other webinars that are coming up, and of course our website for any of our services that we provide. Thank you, everybody. Thank you for joining today.
Thank you, everyone.